We work with our affiliates hand in hand and as partners because we believe that to be able to work and address health equity and the social determinants of health, we need to work together in this space.
Si no hubiéramos tenido la decisión de venirnos a estos apartamentos, nada de esto hubiera haber pasado. Yo no tenía la posibilidad de mandarla al colegio, no sabía cómo, no tenía los recursos necesarios. Entonces, sí trabajaba mucho, pero no es como que te alcanza para, no sé cómo decirlo, como para soñar, como para ir al colegio.
Our community of the West Side is primarily of Latino descent. 70% live in poverty. Median income is about $26,000, and our dropout rate is above 50%.
Before I lived here, I thought I was not going to go to a university or to a college because I didn't really have any help at school. Thanks to MOC, I was able to go ahead and enhance my career with my education because MOC is all about heart and character. It's not like any other program. They are loving, they're caring, and they are like family.
They're providing affordable housing, a safe home for even the elderly to come in, to be able to have a safe environment, to have a warm meal, to give them access to even social cohesion. A good opportunity to be able to talk and have the pláticas with your peers and be able to have some support network.
It's a very welcoming community. It's a happy place. I think all the amenities that we do offer a lot of things that most properties don't. Just the fact that we're always here and we're always willing to help.
Es muy interesante vivir aquí porque se mantiene uno ocupado, hay muchas actividades como el bingo, pláticas que vienen de las oficinas del sheriff para informarnos si sale uno aquí, allá, salir acompañados.
Some of the struggles that I see that our residents have here is they're on a low fixed income, so just financial hardships we do see a lot where their monthly checks from Social Security aren't really stretching the entire month. So with MOC we have the financial counselors there that kind of just get them on a plan and try to get them more situated with their finances.
Our housing counseling network is very well positioned to really expand the multi-services that they currently provide, not only in housing education but also financial opportunity. And why this is important for health is because oftentimes when you don't have a stable housing or affordable housing, that starts to look and impact the health of your own individual's health, but also your children and your families.
First thing we do is they do the financial coaching. We make sure that they get their energy assistance paid for, and then we start to dig a little bit deeper with the SNAP application for them to get the food stamps, then with the Medicare or Medicaid to ensure that they have those. If they don't have those, ensuring that they go to a health clinic that's local because we're aware of that, and then eventually we then ensure that they also access mental health services because that's a big component.
Evitar la pérdida de la vivienda de la casa influye en un hogar más estable, que no se pierdan los valores, que el concepto de calidad de vida, porque tenemos un hogar, prevalezca.
Several years ago, our community did not have a supermarket, and so they said, we need a supermarket. So APM worked to bring a supermarket to the neighborhood that actually provides, a lot of Latino groceries.
And the other piece is really helping put money back in people's pockets, which is helping them pay for those utility bills and also helping them perhaps apply or appeal their food benefit.
We actually developed and sold 150 homes in our neighborhood, starting at $50,000, and we were able to get subsidies and assistance to make sure that the people in the community could stay in the community and buy homes they afford.
The things that I really appreciated from Stonehouse was the opportunities that are available for all of us, because they have a lot of programs, not only for the children, but also for the adults.
UnidosUS and our affiliates believe that everyone should have the opportunity and ability to live their healthiest life possible. In order to do so, our collaboration with community-based organizations and local communities promotes health and well-being in our children and among our families by making resources available that meet their daily basic needs. Safe and affordable housing, access to healthy food, healthcare, job training, financial education, and more. UnidosUS is committed to addressing these social determinants of health by using a Latino health equity lens in pursuit of building a culture of health in America.